Welcome back. Well, hospitals in the central Chinese city at the center of the coronavirus outbreak are calling on public support for protective supplies such as masks and suits as supplies run low. Meanwhile, the number of cases grows daily. More than 800 cases have been confirmed according to China's National Health Commission. I want to bring in Patrick Falk now for the very latest. Patrick, a very, very good morning to you. 25 deaths, reportedly 25 people have died in China alone. Can you confirm this?
Well, 26 now, as a matter of fact, according to the latest reports we're reading. And the latest two are particularly concerning because they're outside of Hubei province. That's where Wuhan is, ground zero, if you like. And that's a suggestion that some of the containment efforts that are being undertaken by authorities might not go far enough. You know, a lot of the containments are focused as such because, as far as we can gauge, there are a lot of people under observation, and many of those are suspected of having a slightly milder form of the coronavirus that is going around. But these two fatalities outside of Hubei suggest perhaps that's not the case. These two, first one in Hebei province, not to be confused with Hubei. Hebei surrounds most of Beijing, so a big concern for the capital city, and the other one in Heilongjiang province, which borders with Russia. But this is a new development and is bringing a lot of concern, a new level of worry, if you like.
Reportedly, Patrick, officials say the source of the coronavirus is a wildlife and seafood market in Wuhan. Tell us a bit about this market. Has it been cordoned off at this stage?
Yeah, I mean, even several weeks ago, they were cleaning up the market when they first knew of the emergence of this disease. But there's a lot of talk about the live animals and possibly illegal wildlife that was being sold as meat in this market. And it's a big talking point right now. A lot of questions about whether or not more needs to be done to prevent this sort of culture of dining on exotic meats. And that's part of the reason why the mayor of Wuhan is copping a lot of blame right now, because, you know, some of these things shouldn't have been happening at all, and they were. There's some rather bizarre pictures that are going around online of bats. There's apparently a dish there that people eat that contains bats, and at least one health expert, in fact, one of the main SARS experts from 2003 has suggested that is a distinct possibility. They are known to carry a lot of diseases. And there are other animals that are being linked with this as well, but that's not been confirmed for the time being. They are desperately trying to find the source, because only when they find the source can they speed up the process of coming up with a vaccine, as far as we understand.
Yeah. Patrick, millions of Chinese people are on the move for the holidays. We're talking about the Lunar New Year. That's a concern. Talk to us about the screening measures at international airports.
You know, at international airports, they are obviously undertaking some strict screening measures, and they've got infrared thermometers around to make sure. One of the things that's difficult, though, is this is peak flu season anyway, and the symptoms, compared to regular flu, are really quite similar, although we are told that people that are suffering from the coronavirus are showing lesions on their lungs. But there's also sorts of other measures that are being taken as well. People have been told not to gather in large crowds, and here in the capital, a lot of the festivities have been cancelled. The New Year markets, they're not going to be happening over the next week. The Forbidden City, China's most iconic landmark and a very popular tourist destination, that's been closed as well. So, you know, as I say, authorities are really going to great lengths to try and contain this, but we're not sure if that's going to go far enough given the new developments, and they may have to come up with new strategies, but it's very hard to know what more can they do at this point.
Patrick, how difficult is it to detect this virus? What are some of the symptoms?
the symptoms, as I say, very similar to normal flu: fever, high temperature, difficulty in breathing, and, as I say, the lesions on the lungs, as far as we understand. It's still not entirely sure just how lethal it is. I'm told that the way you calculate how lethal a disease is you calculate the number of deaths versus the number of confirmed cases. Supposedly, this is still quite a bit off what SARS was, where 10% of those infected died. But there's every chance that the virus could still mutate. It could become more virulent and potentially a lot more lethal.
Yeah, I guess it's all about self-reporting if you have these symptoms like fever and coughing and difficulty in breathing. Are experts saying that this is in fact preventable and controllable?
Sorry, would you mind repeating that again?
What are experts saying, Patrick, in terms of, do they have a grip on the situation? Is it under control?
Well, in terms of prevention, I think the simple thing is people need to wear face masks. And one of the things that's happening in Wuhan is even TV presenters, news anchors are wearing face masks on screen. And, that's partly to set an example to the public that it's a thing that they need to be doing. And here in Beijing, everyone you see on the street right now, more or less, are wearing face masks. Although that said, that simply aren't a lot of people out at the moment. They are all staying in and preventing themselves from being exposed to people that might be carriers of the disease. But, as far as we know, it is passed on through the respiratory tract. So that's why the face masks are so important. And they are literally flying off the shelves. It's one of the things that's happening in Wuhan. Part of the thing with having a quarantine, having the place shut down, is that it gets people in a panic, so they are going to buy supplies, medical supplies, face masks. They're also sweeping up all the stock from supermarkets because we don't know how long this lockdown's going to last. So people are getting ready to dig in for the long term, potentially.
How serious or how concerned are people where you are, Patrick? Because we're watching some interviews with some folks in China, and some are deeply concerned. Others are, taking it in their stride. What's the sense you're getting on the ground there?
It's very funny because it's been a real visible thing over the course of the week. We were speaking to people right on the weekend, in fact, at the train station, asking what their thoughts were. And a lot of them were saying, it's just a little bit of flu and, build up your immune system, make sure you stay fit and healthy. It's no problem at all. At that point, there wasn't that much awareness of just how serious an outbreak this was. It's really been over the course of the week, and as the numbers have multiplied, the level of panic has gone up at the same time. I would say that people are definitely taking it seriously at this point. You may have people that are speaking perhaps with a little bit of bravado, but, the country is taking it seriously. Authorities have sent out a very clear message, and they want to be open and transparent about it. And as I've said, they really are going to great lengths to make sure they can do everything they can to contain the situation.
Yeah. Look, it's a developing story. No doubt we're keeping a close eye on it. Patrick, thank you very much indeed for your reporting. Patrick Falk, they are correspondent in Hong Kong.